Oh, oh, jeez. Oh, jeez.
Yeah.
That felt good.
Okay, so I was looking at your chart and I saw we're having some headaches, we're having some back pain, got a couple different things that are bothering you.
Yeah.
So tell me about what's going on.
When I was 32, I did a lot of CrossFit, did all that stuff, and then I went to figure competitions, but my back would just sort of give out. So then I'd be down for a while. So I went in and got some x-rays done, and they said I had a bulge disc in my lower back. And then I re-injured it about 5 years ago. So that's always been a problem. But then just recently, I just moved to Texas from South Dakota.
Oh, welcome to Texas.
Thank you. So when I came down here, I moved everything in, like it was 11 hours in the U-Haul. I moved everything the same night. And 2 days later, my neck and my back went crazy. And it spasmed and I couldn't really do anything. I couldn't look. It's just really bad.
Yeah.
So I got muscle relaxers. I had to wait a while I did a chiropractor over in Azle.
Okay.
Did massage, but it's still not right.
Yeah, just ain't sitting well.
And I wake up with headaches every day. I go to bed with headaches. So I just want to feel better so I can kind of explore the city.
Yeah.
And just feel better.
Absolutely. Yeah. Okay. Yeah, we can definitely take a look at all that for you. So we're having the headaches every day. Where in your head do you typically feel the headaches?
It's up in here.
In the frontal area.
Yeah. And then the crick in my neck is back, right between the skull and the vertebrae, like right here. But I also noticed like right in the center, so like right in here, there's a little bit of pain. So I don't know what that would be. Okay. But
yeah, you can take a look. Sometimes you just get crunched down in there. Those joints aren't moving well. And then that leads to these headaches that just kind of won't go away. Yeah. And so that's very common for that to happen.
And I noticed too, like since I've gotten this thing, I've been clenching my teeth really bad. So I don't know why I started that in the last month, but so there's just been a lot of stuff.
Yeah. So the nerves that go to the face, and especially around here in the jaw area, they go into the spine and up to the brain, and they follow the same nerve pathway that the upper part of your neck does. And so a lot of times when we have neck issues, we can start to develop jaw issues, we can start to develop headaches. The three of those things go together. And so we're going to treat those as a whole. So we're going to take a look at your upper neck, we're going to take a look at your jaw. Treating all of that will help reduce the headaches and those individual pains in your jaw and in your upper neck. So that's very common for these things to start as one, then move to the next, then move to the next. And it's just like, gosh, everything's going wrong.
Yeah.
So that's normal. Now this pain that you're having here, is that more of like a dull achy? Or is it more sharp?
It's a dull headache right in here. Yeah.
Gotcha. And so for the jaw, we're clenching. Have we noticed any clicking or popping?
I've had clicking and popping for years. So I don't know if I've just always been a clencher and didn't really notice it till recently.
Can be. So we'll see what's going on there as well. And then are we having any numbness or tingling in the arms or hands?
No, but I have a desk job, so I sit 9 hours a day. So, I mean, I do feel there's something going on here, probably from typing, but no numbness or...
Not numbness?
No.
You just feel it's like tension and stiffness?
No.
Okay. Yeah, we'll take a look at all these areas. So, okay, and you've been to the other chiropractor.
Yep.
So how long ago was that roughly?
I went to him, I think Monday. I did a massage Monday. Then I found you.
Okay.
So
pretty close together.
Yeah.
Are we feeling better than we were?
I did the day of, and then it's just slowly starting to get back to where it was before.
Yeah. Gotcha. Okay, let's have you come around over here for me. You'll just have a seat facing the wall there. Okay, let me have you bring your chin down to your chest as far as you can. Okay, yeah, we're real locked there. Let's have you look up to the ceiling back as far as you can. Okay, better that way. Let's have you look over your left shoulder and your right shoulder. Okay, and then we're going to have you tilt to the right as far as you can, almost try and touch your ear to your shoulder.
Yep.
Okay, and then to the left. Okay, so we're pretty limited coming this way. We're also limited going forward. If I press down here, do you get any pain, especially in your arms?
A little bit right here, not anything in my arms.
Okay. What about if we go?
Same spot.
Same spot?
Not really my arms.
What about here?
Same spot.
Okay. If I lift up, tell me if things feel better.
Yes.
Okay. All right, so we're definitely compressed and squished through that area. So let's see exactly what's going on here. Pretty tight there.
And I just can't get it to move.
Yeah, I can feel how locked up you are. That was my knee. Sucks getting old.
It does.
Okay, so your occiput, which is where your skull connects to the first bone of your neck, very stuck on this right side. Left side feels like it might be atlas, might be lower down. So we're gonna clear this first and then come back and see what feels like's left over here.
Okay.
So I'm gonna hop up on the table with you here. You're just gonna lean back on my leg. I'm gonna hug your head. This is a little strange at first. Good. Doing okay there?
Mm-hmm.
All right, this movement's just kind of quick. You just want to stay loose for me.
Whew.
Wow. Okay. Still alive?
Yeah, I don't know why I'm laughing.
It's a common reaction. Now let's see what's going on over here. Loose.
Whew.
Okay, kind of lower down and higher up. So we may actually do 2 over here, but let's start up high. So, okay, you ready for round 2?
Yep.
Go right here. Good.
Oh, jeez.
Okay. All right. How we doing?
Good.
Okay.
Yeah.
All right. We're going to take a second here. Let's have you bring your chin down to your chest as far as you can. Okay, a little better. And then let's have you tilt to the right as far as you can. That's better. Okay, let's have you look over your right shoulder. Okay, look left. All right, back to front and tilt left. Okay, so we're moving a bit better already. We got more work to do. Mm-hmm. So let's have you lay on your back for me. All right, we're going to cross these arms. Big breath in and out. Good. Again. A little bit tight there. So let's go face down, and we're going to try that a different way.
Okay.
Good. We're just going to drop these arms off the sides. Yeah. My hand's going to go under your hip, and then you just want to leave your stomach as loose as you can. I'm going to give you a bit of a twist here.
Oh.
Beautiful. Okay, you doing all right?
Yeah, I'm sweating.
Yeah. Some of these will make you sweat for sure.
Ugh.
Good. Okay. Now, let's have you lay on your side, and you're going to face me over here. Good. Let's bring that hip forward slightly towards me. Yep. Good. Perfect. Let's see what's going on with your low back. Right there. Good. Doing okay?
Mm-hmm.
Well, if you go to the other side. Good. Whew. One more. Big breath. Out. Good. Okay. Super tough on that one. Let's have you lay flat on your back. We're going to decompress your hips. This will help take some pressure off your low back. Good. Okay, definitely jammed up on that right side. Yeah, you got a lot going on.
Yeah.
Scoot you up a little bit. Good. Let's take a look at your wrists and elbows.
Doesn't help I sit all day.
Yeah, that'll get you. Okay. We'll go to the other side. Good. Okay. All right. Now let's take a look at your jaw. I'm going to scoot you up a little bit. So let's have you open, close, open, close, and then just let that jaw hang slack for me. Yeah, we're very tight through there. I'm not feeling any clicking and popping. I'm feeling some movement. So let me listen and see if I can hear any clicking, popping, or grinding.
Okay.
Open, Oh, yep, there it is. Open. Nothing on that side. Open. One more time, open. Open. Okay, so we got clicking and popping on the right. So we definitely got something going on with the disc on the right side. There's a little disc that sits between this joint and the top. And we can start to get it clicking and popping because that disc slides forward. As you open, your jaw kind of pops back up onto that disc. But what's happening is as you're closing your jaw, you're losing it and coming back off the disc. So we're going to try and adjust you, get you in a little bit better disc position, and get this joint to loosen up for us. So, okay. So, I'm going to turn you to the side here. So for this one, I'm going to put this little paper on your cheek. You're just going to leave your jaw as loose as you can. My hand is going to be right here. This one's going to be a little bit fast, but you just want to stay as loose as possible, okay?
Oh,
Yep. Okay. Not going to fight me?
no.
Okay. Good. Nothing like a punch in the face to fix your jaw. Okay. Loose.
Oh.
Good. So those both release quite well. Let's have you open, close, open, close. We still got a little bit of craziness going on over there. I'm going to teach you some exercises at the end here to help with that. And then let's decompress you and try and get some more pressure off of this neck. So, this one seems a lot scarier than it feels, okay? If you lift that head up for me and set it down. So I'm going to wrap this around you, okay? Mm-hmm. You're going to feel a slow pull and then a short little quick one. You just want to stay as loose as you can.
Oh, jeez.
Yep.
That felt good.
Kind of crazy, huh?
Yeah.
Yeah. Okay, nice and easy on the way up, but we're going to take a look at some of those neck ranges of motion again. So let's have you face that way again. Okay, let's see.
I got tingles.
Tingles?
Mm-hmm.
Yeah. All right, let's have you go chin down to your chest. Good. Look up to the ceiling. Okay, and then we're going to go ahead and look over your right shoulder, left shoulder. Okay, and we're going to tilt to the right. Okay, and then tilt left. Okay, so we're still pretty limited. Some of that's going to take a bit to settle out. We're doing much better forward. Go ahead, go forward again.
Yeah, before I couldn't really.
Yeah, you were barely moving before.
Yeah.
So that's been our biggest kind of success out of the day there. But as it starts to settle out and those muscles start to calm down, inflammation starts to calm down, you're going to notice that improve.
Okay.
How do you feel overall?
I feel good.
Good.
I feel better than I have.
Good.
Yeah.
Yeah. Besides being beat up a little bit.
Yeah. Yeah.
Yeah. So some soreness is normal. That's to be expected. What I want to do for the disc. So we want to train your brain to rotate first and then slide. That's kind of how the disc normally works. Let me show you this real quick. You can stay right there. So this is a little model of how your jaw works, okay? And so, you ever seen a snake like unhinge its jaw? So your body actually works that way too, although to a less noticeable degree. So here's your lower jaw and your teeth, right? Here's your upper jaw and your teeth. The joint here is that little pink line in here. They come together on this disc, is the yellow part, all right? Now what should happen normally when you open your jaw is you should rotate first, and then everything slides forward as a unit.
Okay.
Okay. What's happening on your right side, I believe, is that you've gotten yourself off the disc here. So you're starting back behind the disc. As you start to open your jaw, you hear a pop as you're jumping back onto that disc. And then as we're coming back, you're losing it and you're falling off the disc again as you snap back. So it's called anterior disc displacement with reduction. You don't really need to remember that. It's just what it's called. But this is the most common cause of clicking and popping. And I'm only hearing it on your right side, feeling it on your right side.
It's never been my left. It's always been this side.
Yeah. And so what we did is we went ahead and adjusted you. We're trying to get you into a better position on that disc. And now we're going to teach you a couple of exercises to help with that. Okay. First one teaches us to rotate first, slide second. So this one's going to look a little silly, but you're going to take your tongue and you're going to put it on the roof of your mouth in the same place you would when you're saying like no. So the letter N, no. And you can even just hum
No. Okay, yeah.
and hold your tongue there. Then you're going to open your mouth as wide as you can, slowly, and then close. So it's going to look like this.
Okay.
And you're going to do that like 20, 30 times. So try that a couple times for me. You may find it a little difficult to keep the tongue up. Go wide as you can. Yep, and then close. And you'll find around 10 reps that starts to get easier to do. And as you start getting closer to 20 or 30, it gets easier and easier.
Okay.
So it's training your brain to stay on that disc and rotate first because of the muscles that get turned on when we do that with the tongue, and then slide second.
Okay.
Okay. The other thing I want us to do is we're going to do a little exercise where we practice staying on the disc. So what we're going to do is you're going to open till you get that click. And then from there, we're going to take our jaw, we're going to put our hand on the front of our jaw, and we're going to push backwards and forward to slide that disc forward and backwards and try and teach our brain to stay on that disc. So you're going to open till you feel the click. Okay, once it clicks, you're going to push backwards and forwards. Now, forwards, you're going to push yourself with your own jaw muscles.
Okay.
And then backwards, you're going to push with your hand. And is it clicking as you're going back and forth?
A little bit.
Yeah. So we want to try either opening. So we open till we click, and then we want to either open less and push back and forth, or we want to open more. But we want to try and get to a position where as we're going back and forth, we're not clicking constantly. Okay. So let's see if we can find a position where we don't click constantly.
Right there.
Okay. And we're just going to focus on that little narrow range right there where we're going forward and back without clicking.
Okay.
So once we open up and we hear the click, we know we're back on the disc. Now we're sliding, trying to get that disc to slide backward and forward without popping off. Okay. If you hear it click again, we fell off the disc, so we reset the whole exercise. Okay. We open till we get the click, we push back and forth. Okay. Okay. Those two exercises are going to help kind of retrain this and hopefully start to improve that disc mechanic. And that will actually have an effect on your neck pain and an effect on your headaches as well. Okay. Although we would expect the headaches now to start to drop pretty quickly from the work that we did today. So, did you have any questions for me about anything?
No, I'm happy I found you.
Yeah, I'm glad you came. I'm glad you came.